The impact of the COVID-19 to Filipino workers has become worse. The most affected of the COVID-19 pandemic are the healthcare workers. Because healthcare workers are vulnerable to COVID-19 infection.
The frontliners' struggles in the fight against the COVID-19 pandemic. The COVID-19 surprised and shocked the whole world. The frontliners braved the pandemic to save people and even the whole world from the deadly virus. They faced the most difficult struggles in this time of pandemic. Here are some of their struggles. Number 1. No available vaccine for COVID-19. It must be very depressing for them to see hundreds or even thousands of patients die. The scientists all over the world are still doing their best to develop vaccine for the COVID-19. According to some reports, they are now in their second phase of vaccine testing. Number 2. Shortage of personal protective equipment or PPE. We have heard a lot of reports all over the world on PPE shortage. Some nurses are only using face masks with no other protective equipment in assisting COVID-19 patients. Because of the shortage, many of the frontliners became victims of COVID-19 and died.
Number 3. Separation from their families. Because of their sense of service to their country and to humanity, they brave the pandemic without minding the risks. Some of the frontliners succumbed to the deadly coronavirus and left this world without saying advice to their loved ones. Number 4. Fatigue and fear. With a huge influx of patients, doctors and nurses suffered fatigue because of long hours of work and the fear of becoming one of the victims of COVID-19. However, there are some helpful ways to support healthcare workers during the COVID-19 pandemic. 1. Requests for PPE donations and other equipments are spreading across social media. Donations, no matter how small, can add up to make a difference. 2. Providing free foods to healthcare workers. 3. Healthcare workers who continue to work but have no way of getting to and from hospitals and their homes can be assisted by volunteers of efforts like Oplan Hatid and other free transportation services. 4. Attacks against healthcare workers must be prevented and condemned. Partnerships for the prevention of violence must forge. Full accountability for these crimes must be ensured and perpetrators must be held accountable. 5. The faster we follow instructions on social distancing and other protocols, the faster we will be able to get back to being with friends and family. Government should listen to the wants and needs of every healthcare workers. If we stick together and do what we can to help each other, we'll come out of this faster, stronger, and more connected. The pandemic may be showing the weakness of systems we have in our current society, but it is also showing us what bayanihan means for a nation of everyday heroes.